Hello guys, good morning. Welcome back to my YouTube channel. This is Miss Henderson. So thank you again for subscribing to my YouTube channel. Thank you for supporting this channel. And today I really have some questions actually that I'm going to be reading from the computer, and I'm going to be giving you the rationale for the question. These are some questions that you can possibly find on Prometric exams. So, pay attention. And I'm going to give you the answers, but just bear in mind that try to answer these questions while I'm reading these questions. Try to formulate the answers on your own, because when you go to Prometric, you're going to be taking this exam on your own. Nobody's going to be there to really help you. So that being said, I know I like to talk, so little chit chat now and then. The first questions we have here is inactive and immobility may cause all of the following except. Now, a lot of students have difficulties with the word except. And I can remember also in nursing school, in the beginning of my nursing career, I was having difficulty also with the word except. So inactivity and immobility may cause all of the following except pressure ulcers, permanent contractures, increased intestinal peristalsis, secretions remaining in the lung. So inactivity and immobility means that a patient is unable to move. Maybe it's a bed-bound patient and they're not able to get up and do things on their own. Of course, we know immobility contributes to pressure ulcers. Contractures mean that when the muscles kind of get stiffened up and your hands kind of get contracted. So that's contracture. Increase in intestinal peristalsis means that your GI system starts to slow down as you get older. And of course, if you are immobile, that also can contribute to decrease in peristalsis. Secretion remaining in the lung. That's the correct answer for this question. Secretion remaining in the lung. That's the correct answer. Let's look at question number 2. The nurse aide knows that the term up Adlib means the client is not permitted out of bed. B, is independent with balance period of rest and activity. C, is out of bed at mealtime only. D, will need assistance for all activities of daily living. So now this is a medical terminology. In order to understand this question, guys, that's what I'm saying. You guys need to know certain medical terminologies, because if you don't know, how you're supposed to answer these questions. So Adlib means is a patient is independent with balanced periods of rest and activity. That's the correct answer for question number 2. Let's look at question number 3. When lifting a patient, it is important to use good body mechanics. The nurse's aide should A, keep the patient at arm length. B, bend at the knee. C, twist at the waist. Move the patient rapidly. So what do you think is the correct answer for this question? Now, we talked a lot about this in class when we talked about body mechanics. And you guys know Miss Henderson always emphasized that, proper body mechanic is critical in the healthcare field because there's so many nurses and CNAs are out because of they're not using proper body mechanics. Have back problems and knee problems and all sorts of things. So bend at the knee, it's the correct answer for question number 3. So let's look at question number 4, what we have here. Question number 4, a common sign of approaching death is A, increased appetite, B, normal or elevated vital signs, C, severe increasing pain, D, decrease in body function. So we know when somebody is approaching death, their body systems are shutting down. The heart, the liver, the kidney, everything is shutting down. So the correct answer for this question will be decreased body function. Question number 5. Tuberculosis is a disease of the... Now, you have to know what is tuberculosis. Tuberculosis is an infectious disease, and to answer this question, you have to know what it is all about, the basic definition of it. So it affects the throat, the colon, the lungs, the kidney. So what do you think is the correct answer for this question? Tuberculosis is an infectious disease. It's travel, it's an airborne, and we know it primarily attacks the lung because patients with tuberculosis, they have night sweats, difficulty breathing, so on and so forth. And that's the one that they have to wear a N95 mask, tuberculosis. Let's look at question number 6. The nursing assistant notes that the client respiratory rate is 0. Wow. The nursing assistant should A, resume the client's normal care. B, wait 10 minutes and check the client's respiration again. C, inform the client's family that the client is dead. D, contact the charge nurse immediately. So let's say you're a CNA and you're going into a client's room and you find they're not breathing, unresponsive, and they're not breathing. What are you going to do? So what is within your scope of practice as a CNA that you will do that is correct? Contact the charge nurse. That's the correct answer. That's within your scope of practice. We have to contact the charge nurse because that's who we are working under. Question number 7. After a client dies, the client's spouse wishes to share his emotions. The nurse's aide should A, listen and try to provide comfort. B, change the subject. C, tell the spouse to contact a counselor. Now that's crazy. Imagine telling the spouse she just lost her husband or her wife and telling her to contact a counselor to get some kind of emotional support. That might be, at that period of time, I think that might be a little bit too, very, very cold. Send him to the chargers. So no, if a client lost someone and they're going through the grieving process, as a CNA, you should sit and listen and try to provide some emotional comfort. And that is showing like empathy, that imagine if, you were in that situation, what would you do? Or how would you feel? So it's listen and provide emotional support. Question number 8, guys. An example of special device to help prevent contractures or is it hand rule? Is it, let me see what are the choices. We have hand roll, Doppler, air mattress, manometer. So what do you think is the correct answer to prevent contractures? Somebody is having contractures of their arm. What type of a device that you can use that would keep the arm in proper body alignment? So it would be an hand roll. So hand roll is a device. A lot of times, sometimes the PT provides it, or sometimes if you want to be creative and innovative, that's cool. You could take like a washcloth and kind of wrap it and fold it and just put it in the hands of the patient, just to keep the the hands like abducted like that. Okay, so guys, that's it for this video. I just had a few questions and I just wanted to come up here and share these questions with you. Again, guys, please continue to support my YouTube channel. I also going to be linking a Cash App into my description on this video. So if you want to support this channel, can you make a small donation to support my channel? You can also support my channel if you need additional CNA questions, like Prometric test questions, CNA test questions. As a nurse educator, I kind of I use different type of textbooks and kind of formulate these test questions. So you can, to get additional questions, you will have to like pay a little small something to get additional, like 50 questions or 100 questions. You can send me a little donation and I will you'll contact me. My description, it will be in the description of this video, my email, my phone number, and all the contact information. Thank you so much for watching this video. Please continue to like, share, subscribe, and drop your comments below, and I'll catch you in the next video. Bye for now.